Now, cancer specialists say that the risk of recurrence is low, but that there is always the risk of a new lesion developing because of the president's fair skin and the years of exposure to the sun. In the newsroom, I'm David Diaz. Back to you, Angela.
Thank you, David. And as we said, basal cell carcinoma is the mildest form of skin cancer, and President Clinton may be a prime target for this particular type of cancer. CBS 2 Health Watch reporter Paul Moniz is here to explain why. Paul.
Angela, baby boomers are particularly susceptible to basal cell carcinoma, mainly because they spent years in the sun with little or no protection. The good news is this is the mildest form of skin cancer, and it can be easily cured. This is what basal cell carcinoma looks like up close. The curable, slow-growing cancer affects as many as 1 million Americans each year, especially lifelong sun worshippers like Linda Lampert, who seldom used sunscreen growing up.
I had to have this cut out, and then just recently I saw another spot right here, and it was just a little red spot.
Basal cell cancers, like the one on President Clinton's back, are usually treated by cutting out the lesion with a shallow incision. Lasers can also be used. The cancer is common. First Lady Donna Hanover had a basal cell growth removed from her nose 4 years ago. Dermatologist Dr. Bruce Katz says baby boomers are particularly susceptible.
We've all spent a lot of time in the sun. There's been a greater amount of time for leisure. Playing tennis and golf are all very high-risk sports.
But older people can get it too. Just today, Dorothy Hickey and her husband John had their growths removed. Basal cell carcinoma is the mildest form of skin cancer, followed by squamous cell. Both have a 95% cure rate. Melanoma, on the other hand, is less common but can be deadly. In basal cell, the tumors begin as small wax-like nodules that look like pearly white scabs. The scabs sometimes bleed and heal repeatedly. Though they can be removed, few are happy about the scars left behind.
To me, it's a disfigurement. It's really made my nose crooked. It goes to one side and it's red.
Very important, if you notice a suspicious lesion, doctors say you should have it checked right away before the cancer grows. Like any patient recently treated for skin cancer, President Clinton will have to be vigilant about using sunscreen and wearing protective clothing from now on.